we build this session, if you saw the invite online, is our executive roundtable, real challenges, real decisions, real results. That sounds real intense. That's not the purpose of this. Kidding aside, we've asked a couple executives to come up and just share their perspectives, what they're working on, and kind of just like the rest of the panelists, be really candid. So I want to welcome to the stage, we're going to start with Rob Dancer, the CFO of EDSI. Rob, come on up. Rob's willing to try anything, as you guys will find out. Next up, I would like to welcome Kevin Roach, the CEO of MCHS Family of Services. Not only does he have the best shoe game in town, he's our local celebrity who was featured on Fox 2 last night or the night before for some amazing work that he's doing. And last, but certainly not least, April Mataleve, the CHRO of First State Bank. April has done every job at First State Bank in the HR world, and probably other jobs as well. So thank you, April. Okay, we'll start with an easy one. I just want a hot take from you guys. Like, a lot's been said here on stage today. Any just reactions that are bubbling up in your mind? Rob, I'll start with you.
Thanks for starting with me, the finance guy. That's great. Yeah, to be honest with you, I wrote several things down. So thank you to everybody, right? Because I think I had something that I could take away from each and every speaker today. So I don't know that I could narrow it down to one, but we definitely have some more work to do, even though I thought we were doing a good job today. So
okay.
Thank you all. Yeah.
Awesome. Kevin.
Yeah, I can certainly say that it's been really encouraging to at least hear of some of these solutions that are breaking through in what is a lot of chaos and noise. I also think about the impact that it has on the employee experience that they have, and knowing that when we think about how that employee is sometimes disconnected from the employer, the stress, how overwhelmed they are, healthcare just adds to that. And to be able to almost simplify it or spoon feed it is certainly one of those takeaways as I start thinking about how do we bring this education in a more realistic and pragmatic way to our employees.
The people element. Awesome. April.
Just to add to that, it's scary but optimistic on all of the options that are out there. It's great that we have a partner like LoVasco to help us to navigate through all of those different options for us, because it's overwhelming, especially for a small employer.
April, that's a great segue. I was hoping to just give the audience here some context about these organizations that you guys work with. So if you don't mind, describe a little bit about First State Bank, how you guys make money, the demographic profile of your workforce, the head count, and then the structure of your benefit plan.
Well, I think you guys can all imagine how we make money for a bank.
Yep.
But yes, we provide financial services. We have about 190 employees. We're in Macomb in Oakland County, and we are fully insured. And we have about 138 employees on our medical plans. Just a little fun. And full disclosure, I was not supposed to be here today up on stage. Our CEO was supposed to be here, so
there we go, Mark.
The part. Did you get it? Good.
I'm
playing the part of our CEO and CHRO today.
Thank you. I hope that makes its way to social media.
Yeah.
Speaking of that, we do need some sound bites from the audience. So as you make your way out, go see my friends in the corner there and give us a little love. And just share about your experience, maybe just a takeaway.
And if you see it on social media, please comment. And if I don't have a job, that I'm not here next year, please look out for me and help me.
All right, Kevin, over to you.
So I am the president and CEO of MCHS Family of Services. So that was formerly known as Methodist Children's Home Society. But we don't have a legal affiliation with the church. We're just too lazy to change our name on that end. So we scrunched it down to an acronym since none of those elements really fit. We have historically been on the residential treatment side for children who have been abused and neglected, located right outside of Detroit. But we really have expanded our programs and services to be foster care, adoption, a lot of housing programs, education, and mental health, as well as a broad array of community-based services. And so with 6 locations, soon to be 8. I think you'll read about it soon. On this end, we continue to grow and expand that incredible work that we've been doing for really the last 100 years on this end. And so with a little over 200 employees now on this end that are serving all of Michigan and certainly some of the other surrounding areas, it's been really an exciting journey to be a part of this ride for myself, who's been with this company for about 10 years. You had another question too.
Your benefits, the structure.
So the structure of our benefits, we made this jump to be a self-insured group captive program, a self-insured group plan on this end, and we'll dive into those details later. But it's something that is still new to us, still sometimes a bit scary, as for a nonprofit that traditionally has not been in this space, to really take that leap forward and certainly to bring our employees along on that ride.
Thank you, Kevin. Over to you, Rob.
Yeah, Rob Dancer, EDSI, Educational Data Systems. We started as a training consulting company in 1979, so I've been around a little while. Do mostly workforce development work for local governments or workforce boards now, helping people get reemployed through different federal grants that come to the states, come to the local governments or workforce boards. So about 10 states, 950-ish employees, about 700 on the plan now. We went self-employed, or self-insured, sorry, about 15 years ago, I think, 14, 15 years ago. So probably before we were ready, but worked out very well. And then, we've joined captive on the stop loss in 2020, which has been great. That was good timing, too. I don't know if anybody went to the doctor in 2020, but there wasn't as many. So that was good timing on the captive piece for us. And then, I've tried to do some other things with some pharmacy, specialty drug carve-out plans and those types of things. So.
Yeah, do you mind just telling the team here, the audience, a little bit more about the baby steps that you guys took to make these decisions and some of the results that you've seen?
Sure, yeah. I'll pick out a couple maybe. Is that
That'd be great.
So, we use Sharks, right, for the specialty drug piece. I don't know if anybody's familiar with them or not, but we, that captive that we're part of, too, for the stop-loss piece was really a good push. We looked at it 1 year before we actually made the jump, decided not to make the jump just because we weren't sure about the employee disruption and the sourcing piece, right? Because a lot of out-of-country or international sourcing pieces, so we weren't sure about legality and some of those issues, right? So we didn't want to get in any trouble. We went to the group captive the next year, and there are several members that had made that jump and were saving significant dollars on it. So made the jump the next year. Last year, 2025, was our third year under the plan, and we've saved $1 million, $1.1 million for the plan that year, obviously. $50,000 specifically for employees, too, under that piece. So that's been great.
And that's you guys sourcing your drugs internationally?
Mostly internationally.
Through Shark
and I think
RX.
they also do a fair amount of direct to the pharmacy.
We could ask Trevor.
Manufacturers, yeah. There's people that know that answer better than me.
Okay. All right. And that's Shark spelled with an X on the end, right? If anyone's taking notes. Okay. Thank you. Kevin, tell us about your journey. I mean, you've got a lot of stakeholders, the community, the board. You mentioned public, support, and you guys, on paper, you might not look like the best risk for some of these programs, but you dived in. Tell us a little bit about that journey.
Yeah, I think for us, we had kind of a little bit more of a complicated picture. So when I started 10 years ago, we had about 70 employees on this end, and about half of them were unionized, and the other half were not. And for a nonprofit that historically may not be as competitive as some of our for-profit counterparts in that compensation space, we really took a look at those benefits on that end. And at that time, we were paying 100% of the premiums for those employees. And that was kind of our moment of pride to say, well, we may not be able to do this, but we can certainly do that. Well, when I stepped into this organization, we were losing about a couple $1 million a year. So that was not working. And what we thought was a competitive advantage for us, it really wasn't, because the turnover rate for our organization was just sky high. We do a little bit of foster care right back then, and one of the stats that kept sticking out to me that I thought was really kind of the engine that drove us to really take some risks and really take a look at how we could improve this employee experience was that for our foster care children, the statewide average for a turnover for that case manager is roughly around 80%. The research shows that when one child in the foster care system changes the case manager, they stay in that system for another 7 months. And if it's twice, it jumps up to 13 months on this end. That was 10 years ago on this end. COVID came along, the Great Resignation. So you can see where those numbers have probably trended since then. If I'm a child in that system, those outcomes are pretty poor, right? It's the equivalent of purgatory. And so we knew that if we wanted to improve outcomes, drive in more revenue, right, increase the numbers that we were serving, we really had to tackle that turnover piece. And when we kept going back to our case managers who were leaving because we had a really high turnover rate with them, it was, we need better health insurance. And we're going to different groups or leaving the industry completely on this end, which once again was not getting us any closer to meeting our mission on this end. And so we really dove in head first on really taking a look at, okay, we need to figure out how to not cover 100% because that formula isn't working. We need to figure out how do we actually decrease our premiums while maybe increasing our deductible. So there was nothing about this that worked, and certainly no selling points for anybody who wanted to come and work, but much less stay with us, that ultimately led to improving the outcomes for the children and the families that we served. So we really started a lot of little things such as education and wellness and meditation, all things that we tried to figure out from a stressor standpoint was really contributing to unhealthy outcomes for our staff, which then led to them leaving that workforce, which then ultimately led to those children staying in that system much longer. And so one of the first things that we did was really figured out that there's no right-size-fits-all approach, right? The one-size-fits-all approach just was not working. And for a diverse group of employees who ranged from living in the heart of Detroit to out into the suburbs to out into farmland, we really had to modify and give more selection options for our employees, but also educate them and really go through a more deliberate education process of explaining to them really how they could maximize the benefits that they had. I don't think for our employees, they really understood that full picture, and they only were in a reactionary mode when they needed something. So we became a lot more intentional about that space. But then we also implemented supplemental benefits for our organization that really tapped into, once again, other pieces of wellness, gym memberships, the Zoom memberships, things along those lines, working from home, an alternative summer Friday schedule where you could dip out at noon on Fridays or come in late on Mondays, whatever it took on that end, and we tiered it. And we got to a point where that became a really big driving force that could help complement our health insurance, but also started to see a healthier workforce. Understanding that when we gave our employees flexibility and options, and this has evolved over time, and we're really proud of the supplemental benefits package that we have really been able to tap into that gives that flexibility and wellness to our employees, that makes them, or at least has improved that retention rate by quite a bit. I mentioned that it's 80% statewide. Ours is around 25%. So you can imagine just how incredible those outcomes are now for our children and families on this end. And then, of course, we took the big dive into this self-insured group captive plan on this end. And like I said, that at that point, our employees understood it. They were ready for it because we had taken literally 3-4 years kind of building up to that point in time. And once again, it matched that notion of flexibility and wellness for our employees and kind of gave us back that competitive edge that nonprofits are constantly seeking for when they're trying to build up their talent base.
Couple takeaways there, just the tie-in for the decisions you're making, tying back to your mission, right?
Yeah.
Serving families and children. That's incredible.
Yeah.
Thank you, Kevin. April, switching gears a little bit, Kevin talked around the decision-making process, but you work at First State Bank. Tell us a little bit about how decisions get made at the bank, and what that looks like for you when you're trying to socialize an idea and potentially make some changes.
So Kelly and I, who my benefit guru here, she's at the first table. We will get our renewal from Mike and his team, and we'll take a look at it first before we bring it to the decision makers. So we'll look at, what are our options? What does cost look like? Can we go out for bid? And we did last year and didn't go so well. But what can we do before we get the whole team together? So our board has to approve our renewal. What they're going to take on for costs, what we're going to push on to the employees, how our plan design is going to change. But before we go there, like I said, we meet and discuss it, and then we bring together what we call a compensation committee, which is a few members of our board, our CEO, our CFO, and get buy-in at that stage first so that we know that we'll have buy-in at the board level. It's continuously becoming more of a challenge because our costs continue to go up on our end. Last year, we had 7 high-cost claims with only 138 employees on your plan. Who has 7 high-cost claims? We have 2 with MS. I mean, it's just, and we're not, it's not in the water. So, but it's just some things that are out of our control, and working with LoVasco to then bring it to the decision makers and having them to see we want to attract talent. And with that, we are competing not just on compensation, but also on benefits. And in compensation, we can't compete with the big banks. We just can't. We're a small community bank. So in the past, we've always been able to talk about how good our benefits are. And we even offer a plan that is a single plan that is no cost out of pocket, out of payroll deductions to an employee. Mike and his team tried to say, this is crazy, you guys shouldn't be doing that, but we knew we still need to offer that for our culture and for us to be able to attract young talent, which mostly we are as a teller in those positions that we hire most often.
Thank you, April. Anyone else have to get board approval on benefit decisions? Couple hands. That's tough. That really is tough. Rob, you guys have a unique structure. You have a subcommittee that you put together, right, of, say, non-benefit professionals. Tell us a little bit about that and how they factor into the decisions you make.
Yeah, that actually worked out very well, right? Because we had a committee of 5 or 6 people generally making the decisions, right, on the finance, HR, tail end. CEO obviously was involved. So that's who generally had made for the last 10 years or whatever. The last couple years, we did expand it to get a benefits committee, and we picked 10 other people, 12 other people from across, many different offices. All that obviously took our benefits. Very helpful, right? From their perspective, we gained a lot of information on how they used the plan, how much they understood or didn't understand a lot of the plan. We had people, one of the women had a son who had cancer, so she understood the plan better than any of us, right?
Right.
She obviously needed every benefit that we had to offer. So that was, very helpful. And some that really were on the plan that didn't use it at all, didn't understand we were in self-insured, what that meant even. So it worked out great on the education, probably back and forth. And that's, we kind of fight the same fight a little bit on, we compete a lot against government and nonprofits who have generally good benefits, especially in the government space, right? So trying to get the best benefits, and as a for-profit entity fighting in that world, at the best cost we can. So yeah, it's a fun battle.
Yeah, that's great. I love the thought of, having these individuals you're bringing into the fold, kind of elevating them up, and then probably when they're out amongst their peers, they are able to help you share your message, which is really strong. One thing that we talk about is really no employer wants to be a guinea pig and experiment too aggressively with some of these changes. But obviously, we're all feeling the pressure from rising costs. So I guess tell us a little bit about where you are on the spectrum. You're kind of early adopter, late adopter, and how you go about just shepherding these ideas into your organization. April, if you maybe start with the FSB perspective.
Well, we're fully insured, and I can also say that we're not an early adopter. that it takes us a long time to get to that next step. And we've been talking about moving to self-insured, and I'm hoping we'll get closer to that.
Amen.
Mike has patience with us. But years ago, we had 10 benefit plans that we offered our employees. Again, that's kind of unheard of. And then, especially for 138 employees that are on our medical plan, our employees like the ability to have options. And as you know, healthcare is unique for each of us. And so we took a lot of baby steps to continue to whittle that down. We now offer 4, but that was, just last year we had 6. So we're moving in the right direction, but we're not early adopters. I'll bring options as my fiduciary responsibility to the compensation committee, and we'll explore, but it takes a few cycles for them to get more comfortable moving outside of the norm.
Yeah, great, thank you. And just tip of my hat to April, you said, hey, there's some, when we asked for your hot take, it's scary. This stuff is scary. And you're kind of revealing some stuff about, how you view the world in First State Bank that, sharing your perspective is really helpful, because I'm sure there's other in the audience that are like, I don't know, maybe we could do this stuff, but I don't want this blowback at the office if one of these things doesn't go right. Are we being too aggressive? So thank you. Kevin, you're also an early adopter, and Rob as well. You guys have just kind of shared that. But Kevin, you mentioned you had a habit of second-guessing yourself when you're making some of these decisions. Just talk us through kind of what's going on in your head when you think, hey, man, did I make the wrong decision? What's going to happen?
Yeah, that's pretty scary going into my head on that end. When we have a tendency, at least on the nonprofit space, to be reactionary and to be cautious, right? And we don't want to take any risks, and we don't want to take any chances, and we're scared to death that employee may leave on this end. But, when we continue to do surveys and check-ins, and I've got our HR guru here in the house. Allison, raise your hand.
Shout out to Allison.
And how she's kind of has put this together, where it's constantly checking in with the new hires. It's also doing these ongoing surveys. And at the heart of that is, a lot of it is, do you understand what is being given to you, right? And do you understand how to access it? And when you consistently hear no, 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 and then that's generally followed by the complaints that this isn't enough, or this didn't cover this, or this was a headache on that end, and right, the automatic reaction to that is the grass is greener somewhere else. They're going to get it right, and they oftentimes don't on this end. And so, for us, the confirmation where we do second guess and we have a larger risk appetite, and we are willing to take some of these chances, such as a couple years ago when we dived into that self-insured space, and we realized that we're never going to understand it all, right? Nor am I going to read the entire 350-page manual that was kind of my introductory packet, right?
That book Luke has too, right?
I know, on that end. And now I can just throw it into ChatGPT, and it'll give me the cliff notes on this end. But, right, we have this, we consume all this information, and we're trying to pivot and make the right decision for our employees at the end of the day. And it still came down to make a decision that's going to improve my life, right, and my well-being and my mental health, and how I care for my family. And when we were tapping into, well, they don't know how to access it, or they don't fully understand it, our ability to at least be able to break that down went a long way to confirming, once again, what we kind of knew all along when we were making these decisions and wanting to take these risks, or expanding that risk appetite, was that if we could meet and respond to those employees, they would be just as understanding if it did not go the right way, or the way that we thought about it, because we were transparent in that entire process in response to those ongoing check-ins or those surveys.
Yeah, that's great feedback.
Yeah.
So thank you, just because, again, you guys are in a unique spot being a nonprofit. One of the things that we've experienced as benefit advisors is when we're getting ready to go meet, with our clients and their staff, there's kind of this thing. It's like, hey, we gotta make sure employees know what these benefits are, how to use them, because people are just conditioned to expect at open enrollment, the benefits are going to get worse, right? The benefits are going to get worse. They're just going to water them down. They're going to cost more money. And trying to combat that attitude is really a challenge. And I'm curious to hear how this group, how you communicate. I mean, Rob, you got 900 people, 10 states. How many people are in Dearborn out of that 900?
35.
35. Okay. How do you get your message out and amplify the good news that you're trying to share?
Not very well.
Okay. Next panelist.
You're right. Thanks for asking. Yeah, no pain point at all. To your point, it's interesting, too, because kids are all older now, getting on their own benefit plans and asking for some advice, right?
Hey,
And
Dad.
it's super easy to talk to them about their deductible, their premium, their co-insurance, their copay, their out-of-pocket max, which plan is the best, right?
Right.
Yeah. So high deductible plan, how much are they contributing to your HRA? Let's do some math type of deal. And then, we have a lot of conversations at EDSI too to, try to get the best benefits with the lease disruption piece, the sharks thing, GLP-1s, right, was on the table this year we covered them, right?
You covered GLP-1s.
We do. It's part of our plan. So that's a huge debate. Last year was the first year we went from 3 plans to 2 plans. Not 10, thank goodness, but 3 to 2. Benefit group helped us decide which ones and then how to adjust them accordingly, which is nice. They got some spousal surcharge. So we're also trying to, benefits and culture are huge because we can't pay as much, generally speaking, in those government contracts as we'd love to pay people. So they're trying to figure out how that all works together. So spousal surcharge is the first time because our benefits are pretty rich and a lot of people were jumping on our plan, right? And a lot of costs were coming from spouses or dependents that are on our plan. So, and balancing that with having a great culture, that type of deal. So it's some interesting conversations and communicate. I guess all of that is complex. I've learned even more today that I didn't know or understand. So that is definitely the area where we lack the most in is the education and communication. They understand it really well when they need it,
Right.
but not generally before. So definitely could use some help in that area.
Yeah, that makes sense. Maybe just switching gears a little bit. I have these panelists on the stage for many reasons, but one of the things is you guys are trying different strategies. Has there been any strategies that just flopped, like gone wrong, and you're like, oh shit, we got that wrong. We got to roll it back. Any of those moments yet?
Yeah, I'm trying to think which one I can admit to on this, since this is all being recorded. So I'm going to dance in here easily, or ease into that question. Yeah, I think like I said, for a social services organization that had this search to improve outcomes and used employee wellness as the primary vehicle, we did do different strategies along the way that probably didn't work out or didn't have the intended target on this end. I know one of those that we did prior to going the self-insured route was we found a great local plan. I don't know if I want to out them or not on this end, but right, they were definitely a much smaller, more boutique plan on this end, and man, those costs were down, right, and it covered a fair amount of what our employees needed on this end, but it wasn't accessible to our employees, right, and so when they had to drive more than like 20 miles or 25 miles, or Detroiters had to leave Detroit to go access this plan, or those in the outer ring suburbs had to drive into Detroit, right? That's where we realized that, man, we went with the cheaper option. We thought it was definitely more affordable. It was in line with that nonprofit experience. But that's what it came down to is, man, we're giving kind of this nonprofit experience to our nonprofit workers, and we have compromised in this area. And the feedback or the amount of complaints that we got when we made that change, thinking that we were going to a much cheaper plan, lower deductibles, right? We were able to absorb more of that employee shared costs on this end. But if they weren't going to drive or they weren't going to go to it, right, it seems still far out of reach. And so we reverted back then to a much larger, the second largest provider, Priority Health, on this end, and then, of course, made that pivot over. But for us at the time, we were jumping up and down thinking we had found a really good solution, and in fact, we had not.
Yeah. Well, thank you for sharing that. Rob, care to admit anything? No? Plead the fifth?
We did. I think the wellness piece is where we struggle the most, probably with education piece.
Tell us
too.
more.
Yeah. So there, we had we hired and paid quite a bit of money, honestly, for an advocacy group and website. You know, we tried it for 3 or 4 years, hoping it would drive consumerism, better consumerism, and then obviously better, choices and resource for our employees. But A, we probably didn't educate people enough on that benefit, and B, we didn't get the return out of that at all. So that was.
Yeah, interesting. April, I don't know. You do such a great job. There's probably nothing
thanks.
nothing we'd walk
That's
back.
just because I agreed to be up here.
That's right.
The only thing I would say is that last year we really focused on more awareness and education. An employee's not going to see one email and they've got it. So, Kelly worked really intentionally on where we need to. We look at the data. Where do we really need to spread the news? And in different ways can we spread it, whether it's on our portal, whether it's through an email, whether it's in a town hall. We actually did multiple of those things because employees have to hear it more than once.
Right. Coming up on the end of our time here, I'm curious. It's early. It's only February. Got a lot of good ideas in our event today. But is there anything you guys are thinking about for 2027? Any changes that are on the horizon that you'd like to share?
Yeah, a couple that were mentioned here, honestly, like direct primary care stuff. We tossed that around last time we were here. And then the reference-based pricing piece.
Oh, interesting. We'll have you to the stage next year to talk about that.
Yeah, there we go.
And Paul, Dr. Paul Thomas, you talked a little bit about your 5 clinics here in Southeast Michigan. There's an add-on note there that you have an affiliation with clinics across the state and country. So for employers that are outside of the state of Michigan or outside of Southeast Michigan, you can offer direct primary care services through this network affiliation that you have, right?
That's correct. There's about 650 different direct primary care doctors in that affiliate network called the HINT network.
HINT. Okay.
Yeah. And so we work with employer groups and coordinate the care with the direct primary care doctors for their remote workers or out-of-state workers.
Thank you for clarifying that. I'm seeing some pens moving, which is a good sign. Okay, I'm going to borrow a question from Luke. If you guys had to cast a final thought onto the audience, word of encouragement, or pretend you're their benefits advisor, what would you be telling the group? The group's out here. April?
As we've said multiple times, education and awareness, showing our employees what we pay for benefits is huge. So your total reward statement at the end of the year, showing them, this cost keeps going up, and these are the reasons why. We talked about transparency today. I mean, I think it is huge that they understand that we're trying to provide affordable care for them, but also it can't come at 10% increase to the bank every single year. So we want to provide really good benefits. We want to take care of our employees, and we're just doing the best we can to make sure that, they're not going to come and we make some big change and they're not going to come and
Rip
at
your
our
head
doors.
off. Yeah. Right. Kevin?
Yeah, I think for us it goes back to our mission, right? And that our children and our families that we're privileged to serve are better off when our employees are better off. And if we are willing to take some of those chances or risks, even when we don't have that full picture, but doing it in a transparent and educational way, where we do spoon feed a lot of this over and over to our employees, to the point that they probably get tired of listening to Allison and her team share, but they get it and they understand it on this end, and they understand kind of the risk-reward factor on this end. And I think that then at the end of the day continues to translate to what we've considered our business model for serving our children and families much better off. It comes with some risks, though.
Last but not least.
Yeah. Well, amen. A lot of that stuff, because the education piece for us is really where we want to spend more time. We had an employee leave. It was a new employee, still under the parents' plan. Didn't think the specialist was covered under our plan. I easily researched after he left to show that the specialist was on the plan. So, obviously we're not doing the best job on the communication education piece. So, love to figure that piece out over the next year too.
Right on. Well, I'd like to thank my panelists and open it up for some Q&A. The audience has been a little quieter than I expected for this event here today. So we can pass a microphone around. I need to start it with one question, and then I'm sure we'll get some more. So is anyone thinking about just a reflection today? There we go. Fire it up.
So our company is fully insured, and I'm the plan admin. I do some other stuff, but 2022, we had a large claim, and it was my husband. So I heard you say out of your 190 employees, 138 are covered under fully insured, and I get the impression that self-funding, we've talked about it, but we haven't addressed it. Seems like it's a big thing here. And I'm just curious, with her 7 claims that she had last year, because obviously we can't predict the health of our employees, how would self-funding have possibly made a difference? Because obviously when my husband was in the hospital, he was in the hospital for 7.5 months. He was in 3 hospitals, and he never made it home. So you can imagine that claim was really large for our company. And I'm wondering if we had been self-funding. As a plan admin, I felt awful, because all I could think of is, oh my gosh, this is going to affect this whole company. And it's not like everyone didn't know, I'm HR. So, but I'm just curious, as if we would have switched to something as self-funded, would those 7 claims, would they be treated a lot differently?
Well, right. Great question. Thank you for sharing. In the case of First State Bank, it doesn't make sense to go self-funded. They got 2 ongoing MS claims that are significant, costs year over year. Stop-loss insurance is there to provide financial protection in the event of a catastrophic claim. And so in the instance of, your husband's situation, that probably would have hit that stop-loss threshold, and then there would have been reimbursements, back to your employer. There is risk with being self-funded. We like to talk about it as a long game, right? If we're in this just trying to figure out what happens every September, it's very difficult to think about, these decisions in a 5-year view. So that is how we approach, this conversation around self-funding. It's not just what do we do when we get that renewal on our desk. It needs to be a longer thought out. I mean, we heard these panelists talk about, the baby steps year over year. You're just chipping away at this.
With the high cost claim limit going up to 150, now we're down to 4. So I don't know if it's still a lot, but we'll see, what our quotes will come in at. Maybe it'll be a different story to take a look at.
Yeah, that's great. More questions. There we go. Adrian.
Okay. I have a question for Rob. You mentioned the pay point of communications and help your employee better understand the benefits that you offer. Do you have ideas and solutions that you will create to kind of get the message out there to engage the employees?
Yeah, I forgot this quote too. Somebody told me, and I don't know if it's somebody up here even, but even a bad plan, well communicated, gets good survey results, which is interesting, right?
That was Luke.
And I think we have a good plan. So I think we'll do more with the HR committees. I think we don't have enough people in all of our locations. We have 60 offices, some with 5 people, some with 90 people. So I think the more we can get that HR committee informed, we can do a better job of that. I don't think we get a lot of emailed out. We're also trying to do a better job of sending videos out, a couple a month with some specific benefit information, and webinars, is the last thing. So we're trying to do monthly webinars on a specific piece of our plan that maybe people don't recognize. I mean, we probably have to do a little bit better job on open enrollment. It's where people actually look at the plan a little bit more. So I think that's the one thing that we'll focus on this year too.
Your CEO loves videos. I think you
Yes.
guys got a podcast too, right? Or you tried a podcast at some point?
Yes.
The 3 Ps?
3 Ps in a pod.
There you go.
Yeah.
It's a great one. Okay. Any other hands going up? None of my finance people are asking questions. A little scary. Okay. With that, can I get a big round of applause for the panelists? Thank you.